Hi there, I'm Dr. Tingle, and I see we have you in for a cranial nerve exam today. This exam should be very relaxing for you, and we will be going over your primary senses of sight, taste, touch, sound, and smell. During this examination, if you feel tired at any time, feel free to close your eyes, and if we find anything that needs treatment, we'll take care of that for you today. So to begin our examination, I'm going to start with a very gentle scalp and face inspection on you. All right, I'm going to have to get a little close, and I'm going to be touching around your scalp, your face, neck, jaw, just looking for any bumps, lumps, or anything that shouldn't be there. So just stay still for me, and I'm going to just get a little close and just going to go through your hair a little bit here. And as I said, I'm just looking for any signs of bruising, any signs of damage, lesions, abrasions, anything that should not be there, but I'm not finding anything. Not finding anything at all, so I think I'm gonna be all set here. Just I want you to just look straight at me, and I'm gonna feel around to the back of your scalp. I'm just gonna apply a little pressure on the base of your neck here. You let me know how that feels. 1, 2, 3. I'm just gonna press. No pain, no pressure. Good. All right. So I continue on with the facial examination. Just look straight ahead. Feel free to close your eyes. I'm just gonna come up here and just gently touch your forehead. Just looking for any sense of like skull swelling, any bumps that shouldn't be there. Okay. Move on to your temples here, and just go and just gently press, press, press. Good. Does that feel the same on both sides? Do it one more time. Ready? Press, press, press. Feels the same? Good. Alright. I'm just going to move down your cheeks here. You're doing great. Everything looks good there. Alright. Now I'm just going to palpate down the sides of your nose here in your T-zone. And then I'm going to take my thumbs. I'm going to just gently run them under your eyes, looking for any signs of like sinus swelling or anything like that. You let me know if anything hurts, okay? Or any pressure. So down the nose first. Just gently press, press, press down the nose. Press, press, press. Press, press, press. Any signs of pressure? Alright, good. Again, under the eyes, just looking for any signs of sinus pressure here. Good. Any pressure? Good. Good. All right. So I want you to just follow along with my instructions here. Just follow along with me. Just going to be looking at your facial muscles. All right. So go ahead and raise your eyebrows. Raise them. Raise them. Raise them. Good. I know, a little funny. All right. Go ahead and give me a big old smile. Good. And a frown. Good. Now puff your cheeks out for me. Good. Do that again, and I'm just going to try to pop your cheeks, all right? Just pop them out for me, and pop, pop, pop. Good. Good, good. All right, so I'm going to look at your neck and jaw area. I'm just going to be feeling around for those lymph nodes, make sure that nothing is swollen. Just want to make sure that you are in tip-top shape. Everything feels good here. I'm going to feel right back on your jaw. And I want you to go ahead and clench those teeth for me. Clench, clench, clench. Good, 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 good. And now swallow for me. Good, one more time. Good. All right. So, a few more things with those facial muscles. So, we're going to do a little muscular test on you. I'm going to press my hand to the side of your face just like this, very gentle. And I'm going to try to press your head to the side, and I want you to resist, okay? All right, so here we go. Just going to put my hand here, and 1, 2, 3, resist, resist, resist. Good. One more time on that side. 1, 2, 3, resist, resist, resist. Good. Do the other side now. Same thing. 1, 2, 3, resist, resist, resist. Good. And one more time. 1, 2, 3, resist, resist, resist. Very good. I'm going to do one more muscle test on your shoulders. I'm going to ask you to shrug them up, and I'm going to try to push them down. Don't let me push it down, okay? All right, go ahead. Shrug them up for me, and 1, 2, 3. Don't let me push them down. Good. Do one more time. 1, 2, 3. Don't let me push it down. Good job. You are doing fantastic. 10 out of 10 so far. We're now going to move on to actually testing those cranial nerves of yours, starting with the smell test. For this, I'm going to be asking you to close those eyes of yours and occlude one nostril. And I'm going to be using one of our new smell triggers, which is our new mist. So all I'm going to do is have you close those eyes, block a nostril, and I'm going to gently spray this mist in the air in front of you. And all you have to do is take a whiff and tell me what it is, okay? All right, so go ahead and close your eyes, block a nostril, and tell me what you smell. Lemon, very, very good. All right, now I want you to keep your eyes closed for me. Block your other nostril and tell me what you smell. Tell me what you can smell. Coconut, very good. All right, you can go ahead and open your eyes. Give those eyes a few blinks. Make sure they're not too dry. And we're going to move on to the taste portion of the exam, which I think you are going to pass with flying colors because smell and taste are very closely linked, and your smell is in perfect condition. So I'm going to ask you to close your eyes again for me and then stick out your tongue. I have a few drops of a flavored liquid here that I'm just going to place on your tongue, and you tell me what it is, okay? So close those eyes. No cheating. Stick that tongue out and drop. And what do you taste? Coffee. Very good. Okay. We're going to do one more taste test. So keep those eyes closed for me. And got another one here. Just 1, 2, 3. Drop. And what do you taste? Chocolate. Very good. All right. So far you are acing this cranial nerve exam. So we are now going to move on to testing your eyes and your sense of vision. This is going to be a longer portion of this exam. So please make sure that you're comfortable. We're going to begin by just doing a simple observation. So I want you to just look straight at me. I'm going to grab my ophthalmoscope so that I can observe your eyes from a few different positions. So as I said, look straight ahead of me. I have my ophthalmoscope here, as you can see with the light. And I'm just going to sit back as for a little bit and just look straight at me. I'm going to observe your eyes from afar. Good. Okay. And the other eye. Good. Good. Okay. So now I'm going to come a little bit closer to you so I can look right into your eye. Just follow my instructions. Just keep that eye open and look straight ahead. Good. Alright. Just look straight ahead. I'm looking at your ocular nerve here, making sure everything is intact. No signs of copper wiring or degeneration. Good. Go ahead and look up for me. Good. And down. To your left. Good. And to your right. Good. Straight ahead again. Good. Alright. Let's take a look at the other eye now. Same thing. Keep that eye open. Look straight ahead. Good. Ocular nerve looks good. No signs of degeneration. No copper wiring. Good. Look up for me. Thank you. And down. And to your left. And your right, please. Good. Wonderful. The inside of your eyes look great. And now we're just going to move on to doing a few eye tests and a brief eye exam on you to make sure that everything is in perfect working order. Alright, so we are going to start with what is called the swinging light test. I'm going to use this occluder to block one of your eyes, and then I'm going to take my pen light here and swing it in and out so that I can watch your pupil dilation and contraction response, okay? Alright, so just look straight at me, and I'm going to swing the light in and out, in, out, in, out, in, out, in, out. Good. And on the other side, in, out, in, out, in, out, in, and out. Good. Pupil response is perfect. Alright, let's look at your tracking response now. So I want you to look straight at my finger. And then, now I want you to follow the light with your eyes. Just follow the light. Good. Good. Keep following the light. Good job. You're doing wonderful. Good. Okay. Now I want you to look straight at me and follow the light with both your eyes without my finger in the way. Good. Good. Alright, now I want you to close one eye for me. Do the same thing, just follow the light with one eye. Good. Good. Close your other eye for me. Same thing. Good. Good. Alright, now I want you to look straight at me and tell me how many fingers I am holding up in rapid succession. Ready? Okay, and good. Good. Good job. Good. 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 Okay. We're going to do one more basic eye test with you, which is just a peripheral vision test. So what I'm going to do is have my fingers up like this. You look straight ahead of me, and you tell me when you can no longer see my fingers and when they come back into view. Alright, Here we go. Good. Good. Good job. Good. Go this direction now. Good. 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 Okay. Now that we've established that your ocular motor functionality is very intact, we're going to do some basic eye exam tests on you, okay? Alright. First one we're going to do is a little color recognition. I have these color paddles here. I'm just going to hold it up and you tell me what color it is, okay? Alright. Here we go. And color is this? Yellow. And this. Purple. And this one. Blue. And this one. Green. All right. And this one. Orange. Very good. And finally, this one. Red. Very good. Let me just put these away. And these red and orange, people get them mixed up quite a bit, myself included, but your color recognition is 100%. So no worries there. I would like to do one more color test with an object before we move on to our eye chart, and that is a little red, green, blue test. Very simple, but one of the most common colorblindness diagnosis. So, which color is this? Red, good. And this? Green, good. And what color is this? Blue. And this? Green. And what color is this? Red. And what color is this? Blue. Very good. And what color is this? Red. And what color is this? Green. Very good. Great. No problems with your red, blue, or green color recognition. And now we're going to move on to one final eye exam today, and that is our classic eye chart here. So I just want you to follow along and read the letter I point to. Good. Good. And read this line for me. Good. And this line down here. Good. Good. Good job. Good. Good. All right. Now we are going to move on to the hearing portion of your cranial nerve exam today. So we are going to begin with a outer ear inspection. I'm then going to look inside with my otoscope to make sure that your tympanic membrane is intact, that your ear canal is nice and clean, and that there's no signs of damage, fluid, or infection. All right. If you'd like, you can keep your eyes closed during this portion of the exam until we get to the actual hearing test. So I'm just going to come over here and just going to take a look at your ear here. Make sure that I'm not seeing any signs of damage or infection, no cuts. Good. The outer ear looks good here. Okay. Move over to the other side. Just take a look. Okay, things look good over here as well. Alright. The outside of your ears look good. Though, I see a little bit of excess wax. So, I think we may need to do a little bit of an ear cleaning on you today if you have some time. Alright, good. Take my otoscope here. I'm just going to take a look inside your ears, so just hold still for me. And I'm just going to put this in gently. Take a look inside. Yeah, definitely have some wax built up. Your tympanic membrane looks good, but your ears are very clogged, so we're definitely going to take care of that today. Take a look at the other side. Okay, same thing. Just gonna look inside. Yeah, very clogged over here too. Tympanic membrane looks good, but yeah. Have you had any pain in your ear lately? Either side? No? Okay. Well, before we are gonna do any kind of hearing test, we need to get those ears cleaned out, alright? So I'm going to use some special drops that'll help soften and dissolve some of that earwax, alright? So you just stay still. I have my drops right here. And I'm just going to come over here. We're just going to go and put a drop in that ear. Good. And that's going to fizz and sound a little interesting, but it will not hurt. And we're just going to drop in that ear. Alright, just gonna let that fizz for a few seconds. It works quite quickly. And while that works, I'm going to get my ear cleaning instruments ready. And this will be a very, very gentle and relaxing ear cleaning for you. You're going to use a very gentle ear brush, as well as a nice fluffy swab. And if anything is super stubborn, we will use a very, very, very gentle bamboo pick to just gently coax some of that earwax out, okay? Alright, I'm gonna grab my light here, and I'm gonna take a look at your ear. Just hold still for me. And I'm just going to gently start getting some of that wax. Gently scraping. See if there's just scoop. Alright, we're going to let these drops do a little more work on this here. Just going to just reapply, drop. Good. Alright. We'll get you out of here with nice clean ears today. And I come over to this side and we do the same thing. Just going to scrape out this way. And while you may have a lot of wax, it's not very stuck, which is a very good sign. Very good sign. Good. Alright, let's come back over here. Let's take a look again. Okay, let's get a little more of that. Let's get that out of there. You're doing a great job. Let's go ahead and just relax for me. We're gonna get the fluffy Come back over to this side. Push it there. Really get these ears. Good. And we're going to go in with the tiny, tiny one. Just make sure we really get everything out. Good. Good. And on this side. Great. Just going to grab my otoscope again, and we're going to take a look inside those ears one more time. And here we go. There we go. Much better, much cleaner. Good. And this side. Very nice. And now you can see your tympanic membrane, and it looks very good. All right. Well, now that we have those ears cleaned, we can actually do some hearing tests on you. All right. So I'm going to ask you to close your eyes. I'm going to whisper a word in your ear, and I'd like you to repeat it back to me, okay? All right. So keep those eyes closed for me. Relax. Good. Sleep. Good. Dream. Correct. Vacation. Good. Coconut. Chocolate. Very good. All right. Keep those eyes closed for me. I'm going to ring a tuning fork now, and I'm going to do it very gently, but I'm going to hold it up to your ear, and you tell me when you can no longer hear it, okay? All right. So here we go. Good. Good. Good job. All right. Keep those eyes closed. One more hearing test. I'm just going to make a noise in each ear. You let me know which ear it is. You can either tell me or hold up a finger, okay? All right, here we go. And good. Correct. Both again. Good. Very good. All right. Go ahead and open your eyes. I have to say, your hearing is perfectly fine. And now that we got those ears cleaned out, you should be feeling much better. And you should also sleep better and breathe a little easier tonight. All right. So we are almost done with your exam here. We have one more portion to cover, and that is your sense of touch. So this portion of the exam is by far the most relaxing. I'm going to have you close your eyes again, and I'm going to touch you with one of two objects. The first object being this very dull acupressure tool. As you can see, it has a very rounded tip. And the second object being this very small, soft brush. Okay, so you're going to tell me dull or soft. Dull or soft, okay? All right, so go ahead and close those eyes for me. And soft, very good. dull, soft, dull, soft, dull, very good, soft, dull, dull, soft, dull, soft, dull, and soft, soft again, dull, dull, soft, dull, soft, dull. All right. You can go ahead and open your eyes for me. How you doing? Good. Well, that will conclude today's cranial nerve exam. And I have to say, everything looks great, but we'd like to see you back in a few weeks just as a follow-up. So go ahead and make an appointment at the front desk on your way out and go home today. I'd like you to relax for the rest of the day. Drink plenty of water and make sure that you get yourself all nice and comfy. Relax with a good show, your favorite book, or whatever makes you happiest, and get a good night's sleep tonight. And we'll see you soon. Bye-bye.